Okay, you guys ready? Hey, thank you for inviting me out here. I was delighted to do an in-service over in Harlingen, actually in Raymondville and later in Brownsville, and somehow the folks from up here invited me to come up, and I really appreciate that. We enjoy, Dr. Benzing and I both enjoy teaching EMS, but also lay folks that have day-to-day contact with things like this, reptiles that can be dangerous. Well, my talk is a little different than most in that I talk about the biology of the animal, and it'll kind of make sense as we go on about how important it is to know the animal in terms of the treatment of the envenomation syndrome. For pre-hospital, the EMS knows that the most important thing is it's treated like a trauma in terms of 2 large bore IVs. You need IVs. And really, if you get bitten by a rattlesnake, it's not worth taking a chance, folks. Go to the hospital. Time is tissue. The tissue toxins from the venom can destroy a limb. So it's not only because of the potential loss of a limb, but loss of life. And I'll mention later on many times how important it is as I talk about the biology of the size of the individual bitten and the size of the pit viper. So pre-hospital considerations, EMS knows that they need to mark, because that way we know if there's an envenomation syndrome, if it's progressing, how bad it is. But also the biology, as we talk about it, will kind of make sense as to how bad the situation might be for you, okay? So we mark the areas to see if there is progression of swelling, but also pain. A lot of times we forget about that pain is a sign of progression of the envenomation syndrome. If the patient will tell you, hey doc, the pain's right here in my wrist, got bitten in the finger, it's up to the wrist. 15 minutes later, doc, the pain's up here or up here, doc, it's moving and I'm scared, you know, and it's very painful. That tells me that there's a significant envenomation syndrome. So not only the ecchymosis, which is the bluish discoloration that occurs, the edema or swelling, but also the pain. So consider that for my EMS folks and my Border Patrol folks, okay? The important thing to do is, I often get them where they're bitten in the, where the wedding band is on that side, and of course you need to remove that wedding band quickly. Anything that's constricting needs to be removed very quickly or it'll become very difficult within just minutes. So you need to get every constricting item removed, okay? Mark the edges, give intravenous fluids. That's why EMS is so important, especially if it's up here. A lot of times they get actually driven down to us in Harlingen. And it's a pretty good drive. So you got 2 large bore IVs in case we need to do something in terms of, and we can get the antivenom into you quicker once you get there, once we have that. But also fluids are important. Normal saline, the IVs that we give you are also an important part of the treatment, okay? The most important thing, and I'll repeat it, is don't use a tourniquet. We do not use a tourniquet with North American pit vipers because they tend to cause tissue toxicity, and the constricting band or the tourniquet can cause actually a worse scenario for you in terms of the extremity, more necrosis and the more likelihood of losing the limb. So always remember, don't use a tourniquet. We often see that. We had an individual up here that was picked up by Border Patrol. It's been a year and a half. He was picked up here near the King Ranch. And he was brought to us. In fact, he was helicoptered to us. And he had been walking with his belt as a tourniquet. Bad thing to do. That arm was so swollen, it was awful. EMS knew what to do, so they removed it. But when they weren't looking, the guy just put his belt back on. And so that made it a little worse for him, but we were able to treat him, and thankfully he didn't require an amputation. And he did recover. But so give intravenous fluids, airway support as necessary. Also to remember for my EMS folks is that anybody that gets bitten above the shoulders, it's a very potential danger for losing your airway. Once the airway swells, we can't put a tube in there to breathe for you, so you can die very easily. And I'll give you an illustration of that later on. So what we do is we prophylactically put you to sleep and intubate you if you got bitten above the face, above the neck. and that is to avoid loss of the airway, okay? Get to the nearest facility. Time is tissue. Always remember that that stuff is like pouring acid or a fire. You need to turn that off as quickly as you can. And the way that we can turn the tide around is using anti-venom. It's the best way, it's the quickest way, and the results are incredible. Once you've seen this time and time again, how it regresses, the inflammation that you see, that swelling, actually gets better within minutes or hours. And we can also see when there's a coagulopathy. In other words, snake venom has three major types of components. One is tissue toxicity that destroys tissue. One is components that cause a coagulopathy for your blood not to be able to clot, and that can be a danger because you can bleed internally, okay? And also a neurotoxin in some species. In other words, it affects your ability to breathe and your ability to be awake and alert, okay? In this case, when we see a coagulopathy, we get lab work. As soon as you come in, we get lab work to see where you're at. If there's a coagulopathy, it is absolutely beautiful to watch that within 3 to 4 hours, something that was horrific in terms of your blood work has almost completely corrected after the first dose of anti-venom. It is impressive. And that can save your life. Use a helicopter if you need to, especially if you're a good distance away. Use your phone, use whatever you need to get to the nearest hospital. If you're trekking somewhere and you're out in the middle of nowhere, get to a place where you can get EMS to get you to the hospital. That's very important. Get those large bore IVs in so we can keep you alive, okay? You do have some time. Incision, suction, tourniquets, these are all things that you used to find in the Boy Scout manual, and they've been actually proven to cause more harm. So please don't waste time with any of this. Don't cut, don't suck, you don't want to do any of that. It actually doesn't help. And of course, alcohol doesn't help. The interesting thing, I just tell you, if you read books or articles on it, it tells you that about 40 to 50% of patients bitten by rattlesnakes are under the influence. Well, I'll tell you, I've had enough experience throughout the country. I've been doing this for almost 30 years, that in West Texas, and I'm not trying to put anybody down, but it was invariably, it was all males, and every single one was intoxicated. So I figured, well, alcohol plays a role in this thing, right? But then I worked in San Antonio where I saw a tremendous number of bites. I mean, it was incredible. I got 2 and 3 consults a day. And I never saw anybody that was intoxicated. But I truly believe that in West Texas, some of those snakes died. Because these people had alcohol levels I can't even imagine. You're not supposed to be alive with those levels. But they walked in and they survived. But so suction devices, these things, they don't remove enough venom to be used. So don't use those little deals. They work for some bee stings and things like that. They might work a little bit towards those, but not for snake bites. Splinting and positioning. This is kind of a real light tourniquet that they use in Australia, but their snakes are different. Just like in Africa, Australia have snakes that are very neurotoxic. They have a neurotoxicity that once it hits the blood flow, then unfortunately you respiratory arrest. In other words, it paralyzes your ability to breathe. And so in those cases, it is called for, but that's in countries where those snakes that are highly neurotoxic live, and that's not here. So this is not for here. Don't transport the snake. We really don't need the snake. A lot of people do that. You're bound to get hurt. I had a case that I really have to tell you. One of my nurses, this was about 15 years ago. Of course, I didn't hear her say that, but she told my patient who came in with family, been bitten, he says, "Oh, we need the snake. You got to go get the snake." And I heard about it a little later before the guy arrived with the second bite victim. Okay, so she sent him home to get the snake, and of course he got bitten, and now we had two patients. never do that. We really don't need the snake. Most of us can tell. Poison control, by the way, always remember poison control to get the best care when it comes to snake bites, so you don't lose a limb, so you don't have to have a fasciotomy, so you don't die. Make sure that they call poison control, and actually our EMS, all of our EMS know to do that, and they'll follow you to the hospital, and these people are highly trained on the treatment of snake bites. Oftentimes you'll find some physicians don't have experience. Remember, a lot of the docs, they only see one snake bite every 4 or 5 years, so they're not up to date with things in the way they should be treated, and they may be more reluctant to use the anti-venom. It's very safe. Honest to goodness, I would use it on my kids without reservation, because it's the best way to keep them alive and keep them from losing a limb. So time is tissue, don't forget. Do no harm. This is actually something interesting that I'm going to teach you a little bit, and you don't have to remember everything, but this is how this helps me. This is from a friend out of California, Dr. William Hayes. He took some of the snakes and he had him bite these things so that he can kind of measure the distance between the fangs to try to predict the size of the snake. Does that make sense? So if they were 2 centimeters apart, for example, the fangs, after studying many of these snakes, he was able to tell with some precision how big the snake was. And I thought, boy, that's pretty cool. And I learned this from him. I spent over a decade. And I thought, I think I can apply this to the care of the patient. And I was able to do that. I was able to predict the size of the snake. 2 things that play a role when you have an envenomation syndrome in the emergency room. 2 things that are really important that a lot of ER docs kind of miss or overlook, or just don't have the experience, and that is the interaction between the snake and the victim. Were you trying to kill the snake? Were you trying to harass the animal? The animal obviously feels threatened, and if they bite you, they're going to load you up with venom, right? If you read the books will tell you 30% of snake bites are dry bites. In other words, they bite you and they don't inject venom. And that is true to a certain point. I later learned from a lot of experience in almost 700 bite victims that the role that was played an important part in the envenomation syndrome. You can almost bet 100% of the time they had an envenomation syndrome if they were trying to capture the snake, they were trying to kill it, and they were bitten. That's a bad scenario. Or if you step on a snake at night, I've had patients do that. This patient did. He didn't have to tell me he stepped on it. This was in Poth, Texas. This is a referral to me. This is a 17-year-old kid. And this was a Western Diamondback. By the way, Western Diamondbacks are very prevalent here. And in San Antonio, the funny thing was that we had 50% copperhead, versus the Western Diamondback. And so the copperhead is less toxic, the venom. So I felt a little better when I knew it was a copperhead. But I could tell if I had a separation in the fangs of 3 centimeters, was it a copperhead? Absolutely not. They're not that big. So I could even tell you the species. Okay? It would be an educated guess, but you definitely, if you had 3, 4, and I've had 5 centimeter separation, that's not a copperhead. That's going to be a Western Diamondback or a canebrake, a timber, which we do have some, by the way, just north of here, around Victoria. Lots of them. And those are that venom, I think it's a little more toxic. But when you talk about a Western Diamondback, guys, whether it rattled or didn't rattle, or a timber, for example, you got a serious problem. Don't hesitate. Don't waste time. Go get seen. Go to the hospital. Call EMS. I mean, that's one time. I mean, people come in with a hangnail. in EMS, you know. But this is a good reason to come in through ambulance, because you come in with your IVs placed. You don't have to wait in the waiting area for somebody to figure out it's a bite. What kind of bite? No. You come in through EMS and they're calling. They've already called, before they call us, they've already called poison control and they're calling us. How did I know that this was a step-on? And of course, if you step on a snake, they feel threatened. That's going to be an envenomation syndrome. I don't care, I don't care who says otherwise. That's going to be an envenomation syndrome. Plus, he's got a little ecchymosis, a little bluish discoloration, and he was bleeding out of one of the sites. Why did I know that? Well, if you step on a snake, get off of me. They're hitting you. They hit you multiple times trying to get you off. And that's why he's got multiple fang marks. And so that was an easy one. That was really interesting. That was apparently the smaller Western Diamondbacks have a lot more hemotoxicity. It was so interesting. If anybody's on Coumadin or knows about Coumadin, the blood thinner you get when you have a heart condition, they try to keep your INR, they try to keep your blood thin between 3 and 4. All right? 3 and 4. 3 and 4. And if he's got a 3 or 4 INR, he was in a car accident, that's dangerous, be careful. Well, this kid had 240 was his number. You know how many platelets? Platelets are normally above 160,000, 150,000. 0 platelets. I mean, this kid could just have an internal bleed just from nothing. Can you imagine an accident? This was Wednesday, I'll never forget. And he's on a 6-man team. He's a star quarterback, and he wants to know if he can play Friday. Oh, absolutely not. Absolutely not. Okay, so this was a 17-year-old, did great, didn't lose anything, okay? But that's because we did the anti-venom quickly, okay? Identified the fang marks, marked the area, and you observe at least 8 hours. This is something that a lot of doctors forget and make the mistake. The minimum, the standard of care for saying, John Smith, you got a dry bite, is 8 hours. A lot of the ER docs will watch you for 2 or 3 hours and say, you got a dry bite, go home. And then they get in trouble. I had a kid actually got in trouble with a Mojave. He was bitten in Big Bend. And Big Bend is the only area west of the Pecos River. In Big Bend National Park, you have the Mojave, which is highly neurotoxic. It looks a lot like the Western Diamondback, but it's highly neurotoxic. Well, that kid ended up on the ventilator. He went home and then got sick and got brought back and ended up on the ventilator. So because it's hard to keep nowadays people in the emergency room for 8 hours, what we do is just put you in overnight. And trust me, let them do that. Watch you overnight, give you some anti-venom, or if you need it, or if they see that there is an envenomation syndrome, and get you out of there the next morning. Trust me on that. That's the way to go. These are some of the labs for the people that take care of them in the hospital. Regular labs. We look at the CBC, to look at the platelets, look at the coagulation profile, and then EKG. I've actually had 2 patients have a heart attack just from the stress of the bite. They had a heart attack. A STEMI, if you can buy it. So these are some things that I learned from friends in the business. One is Dr. Straight. A lot of the numbers that I'm going to give you are from Dr. Straight, Richard Straight, who is the guy that actually spent many years of his life developing the anti-venom that we use every day. LD50 for the Western Diamondback is approximately 25 milligrams, okay? That means that lethal dose 50 in mice and rats, where the experiments that they do, it's about 25 milligrams. To give you an idea, a small newborn Western Diamondback has about 15 milligrams, approximately maximum capacity 15 milligrams of venom, okay? I'm going to try to explain to you a question that I often get asked is, are the smaller ones more dangerous? And the answer, as you will soon see, is the answer is no. So a little one has 15 to 20 milligrams of venom. So the worst case scenario is it gives you the whole dose. It's still not a big dose, and therefore I don't have to use as much anti-venom. Does that make sense? The anti-venom that we use has to kind of match the venom in the body in order to neutralize it, to get rid of it. It neutralizes the venom, and it's excreted through the kidneys, through the urine. These are really important things. A very small child in a very large snake is a recipe for disaster. These little kids are going to die if we don't do something. This is where you don't waste time. This is where you get a helicopter. This is where you get an ambulance. They will die. And call them in the ER. Let them know. Big snake. EMS, you tell them, big snake. Doc, you listening? Big snake. Got a little kid coming in. Okay? Because they will die. They will die. And there's a case that you can read up all about it. It's Peyton's. I think it's called Peyton. You can look it up. It was a little girl. I think she was 2.5 or 3, and they waited too long. She was aerovac'd to the hospital in Fort Worth, and unfortunately, I think there was a little lapse in time, and she paid with her life. It was a very large snake, and this happens often. And so we need to be aware. Small victim, large snake, we got a problem. Okay. Evidence of envenomation, don't hesitate. Don't hesitate to give the anti-venom. Some of the docs, we used to have an anti-venom that was very dangerous before 2000, but it's not anymore. It's very relatively safe. I've given it hundreds of times, and I've never seen any serious reaction. I will tell you that kids, from my colleague Adam, I always remind them, and kids in adolescence, I don't know why, they have a reaction that's called rate-related reaction. In other words, what we do is we start the anti-venom slowly for about 10 minutes to kind of see how the body's tolerating it. And kids do fine until you put it, and then you got to put the whole thing in an hour. When you start that speed up, they turn red, but it's not an allergic reaction. A lot of docs see that, oh, it's an allergic reaction, let's stop it. No, you just slow it down, and I've done this so many times. You slow it down. When they consult me, I'll tell them, just slow it down, you'll see there's a difference. And immediately, the redness goes away. It's almost like a vancomycin, Redmond syndrome, and they get better. The other thing that I do that's different from most docs is that I pre-medicate. In my opinion, I believe that there is benefit to using a steroid, and I use Benadryl before I give the antivenom. That's from way back. The guys that know a lot about this, and even more than I do, will say, the funny thing is they publicly say there's no reason to give Benadryl or steroid. They'll say that. But I mean, you get them behind the curtains and you say, hey, tell me the truth. Do you use it? And they do. And I'm telling you, after hundreds of patients that I've treated, I think there is a benefit in terms of the recovery time. I use steroids for just a good 24 to 36 hours, and that's it, and I stop. And I think there's actual benefit to that in terms of the recovery of the inflammation. So this kid, thankfully there was a resident, really smart, that intubated this kid. This kid came in, was bitten on the cheek, and the kid was intubated immediately. This kid, the airway would have closed, and that would have been the end of it, okay? But they intubated the kid, and just a few weeks later and 3 months later, he fully recovered. The difference between life and death, okay? But antivenom played a role in quick thinking by the part of the doc of intubating prophylactically. It's just like a burn. When we see a burn victim, an inhalation where they were in a room where there was a lot of fumes and it ignited, we have to assume that you got airway burn. And so those are the patients that we also intubate. We breathe for them prophylactically or prematurely in order for us not to get to the point where we lose the airway, where it's impossible. You can't even do a trach, guys. You can't even access through a trach. That's it, game over, okay? These are just some pictures of a snake bite. This was a lady there's a 4-centimeter separation. This was a big snake. Okay, this was a 5.5-foot snake. And she was feeding her horse. This is in Floresville. As she was feeding her horse at 5 in the morning in the dark, she went out and she had some grain that she was scooping up, and she was in her sandals, right? It's dark in her sandals, and she's got a pallet. She stuck her foot underneath the pallet. Well, that kind of threatened the snake that had been waiting for mice down there. You know, you got feed where the mice come in and share the feed. And then, of course, the snake is there to catch the mice. And so she got nailed pretty hard. I knew this was going to be a bad envenomation syndrome, and it took close to 50 vials of any venom. But what we look for, here's the other important part. We look for stopping the progression of the envenomation syndrome. In other words, we can give 6 vials, and they're expensive. They are expensive, 6 vials or 12 vials, and we watch and see, is that swelling continuing to get worse? That means that there's progression, and you cannot stop the treatment. So you give another 6 or 12 vials or whatever, but at least 6 vials, and you repeat it until you stop the progression. Once you stop the progression, then we have to give you about 2 vials every 6 hours, and it's called maintenance for a total of 24 hours. And if you do those things right, patient goes home in 36 hours. I've only had one patient go home in 48 hours. Of all the patients I've treated, everybody got to go home in 36 hours because we did things very fast, very quickly in the ICU because we have to monitor things, okay? And so it's very important to do that. This was a little western diamondback. They have this raccoon tail looking thing, little raccoon tail. And this was a small 12-inch snake. And I got called to the emergency room. It was kind of interesting because I got called 2 days consecutively for a small snake. And all they tell me in the ER is, hey, doc, I got an 18-year-old with a snake bite. That's, well, what happened? I mean, but they don't give you much of a story. So you get the story from the patient. But I went in there and I said, well, it's going to be a dry bite. But it was an educated guess. But wait, doc, how do you know? How do you know it's a dry bite? Well, it's a small snake. You remember what I told you about a small snake, how much venom they have? Very little venom, right? And so why would this snake strike with a dry bite? Anybody guess? You know exactly why. Say it. The stomach is full. So it ate. And sure enough, now we still watch them, and it was a dry bite. The very next day, to my surprise, the only time it's ever happened, hey doc, I got a snake bite. Okay. So I go over there, and it's again a western diamondback. This is in Seguin, Texas. And I said, it's going to be a dry bite. Wait, how do you know? It was a different doc. How do you know? Wait, don't leave. How do you know? I said, because it just ate. It's a small snake, and it just ate. And sure enough, we still watched the patient, and it was a dry bite. Okay? But that's why it's important to know a little bit about the biology of the snake in terms of predicting the envenomation syndrome to try to protect your patients. A rate-related reaction that we talk about. If anybody ever tells you we're going to need to do a fasciotomy, they destroy your extremity when they want to do a fasciotomy. A lot of the surgeons will look, oh yeah, that needs a fasciotomy. Tell them they have to measure the compartment pressure first. Please don't let them touch your extremity without doing a compartment pressure, because the vast majority of times you don't have a compartment syndrome. You don't. And they do all that. I mean, it's extensive surgery that actually people end up crippled because of it. I had a Border Patrol friend that ended up out of work for over a year because of the fasciotomy that he got it was like 12 hours into his stay in the hospital. But if you treat him appropriately with any venom, you won't need any cutting, okay? So make sure. So if they're going to cut on you, you have a compartment syndrome, sir, I want to cut on you. What do you tell them? You measure my compartment syndrome, or you call poison control. Call poison control. Measure my pressure. Yes, sir. Say again. You get him a mic. ¿Cómo? Testing, test. Funciona. Testing. Testing, 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 testing.
Can you take a picture of that?
Take a picture of what?
Of that screen?
Yeah, you need a picture of that? Yeah, we'll send you one. Anybody that wants anything, you can. I'll give you my email, and you can take a picture. Yeah, or I can send it to you. You'll have my email, and you can correspond if you have any questions about anything. Yeah, you definitely do not want anybody cutting on you, and please don't let them do an amputation. I've had a friend that had an amputation after 36 or 48 hours being in the hospital. They was called. I was given permission to get the records, and it was funny to me as I read emergency amputation. There's no such thing as an emergency amputation. There really isn't. I mean, in our business, I remember as a young student, I would see a veteran come in. I worked at the VA, and he'd come in with a necrotic foot. I mean, it was dead. Come in and doc, what I do? Well, it's that foot's dead. I think it's going to have to be amputated. Let's go see the surgeon. And I kid you not. And this happens today. And they say, Doc, I don't want to amputate it. And it was mummified. And they go home, come back 2-3 months later. Doc, what do you think? Hell, it's still dead. It's mummified. Well, I don't know. I don't want to take it. And they go a year, and then finally they give in and let them amputate. It's a mummified foot. I mean, so there is no such thing. Give the leg or the extremity, the arm, a chance to heal. I'm not going to say there's no indication for a fasciotomy. But if things are done right, you shouldn't have to have anybody cut on you. Now, there are some people in West Texas, I did experience that. Okay, they weren't, their alcohol level wasn't low enough for 2 or 3 days to have some sense to come into the hospital, and then they come in with a lot of problems. Now, some of those people would require a fasciotomy. So if you come in early and you do everything right, you should be able to go home and live a happy life, not die from it, okay? Poison control, a very wonderful service that's there for us, and it's a free service. And they have experts everywhere. They all have experts on snake bites, among other things that they're experts at. And they're there to help us, okay? All right. Acute compartment syndrome, this is for when I do it for students, medical students, and the pressure really 30 or above, that's when you really have to do a fasciotomy. But you know what? Close to 700 patients I've treated, and never. And I'll show you a really bad one that I had that actually came in 6 hours late. She was a fighter, one of the first female fighter pilots from San Antonio. This is something that I teach my students about, and I might just kind of give you an idea about this so you won't think they're fooling you when they tell you about this. There are some drugs that we've developed that they're called Depo, Provera, Depo this, Depo. Depo means that it's deposited, so it gives you a little bit at a time. Does that make sense? Like Depo, Provera? Okay? Well, when the snake bites you, we figured out that the snake, when the syndrome that you're treating, the envenomation syndrome that you're treating, is actually the floating venom that you're actually fighting, the circulating venom. We didn't know till sometime later that we would treat these patients. Let's say like the kid, for example, the kid that I told you, 17-year-old, the INR was on 240, the PT, it was horrible, right? We fixed it in 6 hours. We sent them home in 36 hours, but we had them come back because I knew about this syndrome. I had them come back 48 hours later, and sure enough, everything was out of whack again. And that's called the Depo effect. That was coined the Depo effect because it was the venom that was still laying in the area, the site of the bite, was now seeping into the circulation. Does that make sense? So sometimes these patients have to be brought in one more time a little anti-venom. It's easier then because we use a lot less anti-venom. We watch them for 24 hours and send them home, and that's the end of that. Okay? And so I teach my students that. And this is for my students too, in continuous infusion. This is to save money. This is where we only use 2 vials in 24 hours. It's not FDA approved, but there's studies out, and we use it that way for the depot effect. That way we only use 2 vials instead of 6 or 12, or and it works. When you see intractable vomiting and diarrhea in a snake bite victim, you got a person that's going to die. Do you understand? That person's going to die. That's an envenomation syndrome that you don't want to see. When they say, hey, doc, I got bitten by a snake and I can't quit vomiting, and he's just pouring out diarrhea, those are patients that are very, very ill, critically ill, and can die quickly. Okay? So EMS, please, if you ever have somebody like this, know that you need to get those 2 large bore IVs and get both IVs going, and be ready, and tell your medical director that you're coming in with someone who's very ill. Poison control, I think everybody should have this on their speed dial. They're very helpful, and we can talk to the medical director. The people that answer the phone are actually very talented and can help, but we also have the right, we all do, to ask for the medical director of poison control, and he will be on the phone for you, okay? And sometimes we do that when we have a really complicated case. This was my pilot. She's actually retired, and she was flying commercial. And she has a horse, and she was with her horse, and she tried, her horse was about to get bitten, and she got in the way. And this is kind of what happened, but she went and took a shower, and she came in 6 hours later. Normally they come in right away, but she's a tough fighter pilot. And so she came in, and she looked like this. This is the anti-venom. We used a lot of anti-venom. And this is time lapse. If you can see the time, it was bad because, I mean, she waited. It was a big snake, and the snake was the horse was scared, trying to trample the snake, and she was trying to get the horse out of the way. And so this snake was upset. Okay. So she had that, and as time went by, we did treat her with anti-venom and no fasciotomy. And basically, she recovered completely and regained dexterity. And she continued her career with the airlines. No fasciotomy. I think this is the 17-year-old again, a different picture. And that's Crofab, the anti-venom that we use, that I'm really happy that we have. We've had it since 2000. And yes?
Did she have extensive therapy afterwards?
She did.
Right?
Yeah, she did. She did. Yeah. In fact, some of those pictures are during therapy. Yeah. So I get a call. This was this year. I get a call, Doc, I have a rattlesnake. I got a rattlesnake victim, and this is from the ER, okay, from a colleague. And I said, well, you're not going to have any trouble with this rattlesnake. It has no rattles. And I said, and so he sent me this, and of course we reassured him that it wasn't a pit viper. It wasn't venomous. And it had eaten. If you can see it's eaten, but it doesn't really matter in this case because it's not a pit viper. And he sent me also the pictures of the bite. And generally when it's a non-venomous bite, you see a scratch. It's kind of like a scratch instead of a fang mark. And so with pit vipers, you can see one fang mark, you can see two, you can see three. Sometimes they'll have 3 or even 4 fangs because they're shedding. But even one fang mark can get you pretty sick. Bear that in mind. Okay, and anyway, so I'm not going to talk about, this is a king snake and a coral snake. The king snake was eating a coral snake. I'll just tell you real quick, this was a 40-year-old firefighter that was trying to show his kid how beautiful this king snake was. So he picked up the king snake, and of course it regurgitated. He picked them both up. He didn't realize there were two, but then he saw it. And so the coral snake released the king snake and promptly bit him. So he was in the hospital for 24 hours. Coral snake bites, you have to keep them in 24 hours because it's at least 24 hours to make sure there's no envenomation. Generally there isn't. They're too small. This is a big one, but it turned out, actually this one was, we did have signs of envenomation on this one. I apologize. Most of the cases we don't. And I like to talk about, there's one of my superheroes, and she's dedicated most of her life to teaching others and to research that's been extremely important, that has probably impacted in our lives. And the neat thing is that she's a local person, and her name is Elda Sanchez, and it's somebody that I dearly appreciate and respect, and I'm really happy that she was able to come in to see this today. And by the way, she runs a facility at the university that actually does tremendous work, and I think she deserves all our support and acknowledgement, and you sure have mine. I'm so proud to be able to say that you're my friend. Thank you. Well, I'm going to briefly give it over to Dr. Benzing, and he's trained in emergency medicine, but he did a fellowship in EMS, so he runs EMS groups, and he is very focused on what the care is on the field and in transport. And I'll give the floor to my colleague.
Testing, testing. Everybody hear me? Broadcasting? Okay. This is not appropriate response to snakes, by the way. Oh, no. Okay. We're good. Let me grab my computer. Yeah, tengo un... sí. No tengo. Ok. Bueno, ya. Okay. All right. Everyone's still working? Everyone can hear me okay? Okay. So Dr. Gross gave us a lot of information about the snakes, okay? So what I want to focus on is kind of all that good information he gave us, kind of drinking from a fire hose, right? I'm going to try to break it down to what is most relevant in terms of what you need to know if somebody gets bit, okay? And I designed this presentation to really focus on EMS providers, paramedics, EMTs, but the information is the same for the real first responders, which are all of you, who are going to be the first person who's responding to somebody who gets bit and before 911 is able to get on scene. So if anyone has any questions, feel free to interrupt as we go along, okay? This is not a long presentation, but hopefully it's really relevant information for you. So first and foremost, best practices, and this is probably what's especially relevant, and it's a little bit of repetition because it's important, is there certain things we don't do, and there's a lot of information out there that is old information. We do not apply tourniquets to snake bites. We do not suction the wound. There's a lot of devices out there that are for sale. They don't work. Okay. We do not cut the wound in order to try to suck the venom out or release the venom. We don't really apply cold packs, which is called cryotherapy. Cold therapy does not work. In some parts of the world, they actually use tasers and electric shocks, thinking they can try to neutralize the venom. Also, that's not been shown to be very effective. So, bottom line, kind of the point of this slide is that talk about it, but there's very little in terms of you can do for first aid management that is going to neutralize the venom. This is why anyone who gets bit, you need to call EMS or you need to get that person to a hospital, because venom can be delayed up to 8 hours, or even that's what we have at the hospital. That's what Dr. Gross and I are giving in the emergency department. From an EMS perspective, airway, breathing, circulation, those are the first three things. From is rapid transport to the nearest facility that has anti-venom, okay? And that will be any of your trauma facilities and your local facilities here, because snake bites are so endemic here, your facilities are well stocked on the anti-venom. So let's talk about your initial evaluation. Your first look at your patient. What are you thinking and what are you looking for? The first thing you're thinking is your safety, okay? So then the first thing about your safety is stay away from the snake, okay? I don't know if Dr. Gross mentioned it, but even if the snake is dead, a snake can still have a bite reflex for many hours after it's dead. So even if it's been killed, it can still bite you. So do not go near the snake. We do not need the snake, all right? If you can get a picture of the snake from a safe distance, that can be helpful, but it is not necessary, okay? Next is your ABCs. This is how well is their airway? Is there any swelling in their face? How well are they breathing? Are they wheezing? Are they struggling to breathe? Are they having difficulty breathing? And how is their circulation? Are they really pale? Or are they bleeding? Okay? Those are the things you're looking for in kind of your initial evaluation of how sick might this person be right now. Of course, for our EMS providers, you're going to be getting a first set of vitals, and you're going to be starting IVs. Obviously, you're going to start them in the limb that is not bitten, okay? So for your history, this is especially relevant for our EMTs and paramedics, your standard sample history is useful here. What sample stands for is your signs or symptoms. What are the symptoms that this person is having? What allergies do they have? Do they have any allergies to medications? Do they take any medications? That's kind of relevant to what medical conditions they might already have. What's the pertinent history? That's both their medical history. What's the last time they ate? And then the events that led up to this incident. Now, it's the events, the E there, that's especially relevant. Things that, information I'm looking for as an emergency doctor. When this snake bite comes in, I'm really interested to know the time of the bite. When did this happen? How long ago? Did this happen 6 hours ago, or did this happen like 10 minutes ago? That's relevant to me. And then also, the symptoms of envenomation. What symptoms is this person having? So when paramedics are calling their report into me and they're saying there's basically no symptoms, or there's lots of swelling, they have low blood pressure, that gives me a very different picture of what I need to get ready to take care of before when that patient arrives.
And then another piece to this is also,
what were the events that led up to the bite? This is what Dr. Gross was saying, was helps me predict, you know, is this likely to be an envenomation? Were they chasing the snake? Were they trying to hit the snake with a shovel? Or were they just walking through the field minding their own business when the snake tried to warn them, okay? That helps us predict how likely the person is to likely be envenomated.
now the symptoms of envenomation.
When we talk about poisons, certainly from a physician perspective, different poisons have different symptoms associated with them, okay?
This is what this graph down here is showing.
So what we call those symptoms associated with different poisons, we call those toxidromes. And so as a doctor, I can learn these toxidromes and kind of predict what you might have been poisoned with based on the symptoms that you're having. If I have somebody who come in who's just confused, let's say they were just found unconscious, no one knows anything about them, they're confused and they can't give me any history, there's certainly clues I'm looking for on my physical exam on different symptoms, vital signs, that might clue me in to some type of poisoning that this might have been, or an envenomation, for example.
And so this is kind of helpful. There's 3 categories of different snake venoms.
Okay? And different snakes can have different combinations of these different venoms. So some snakes will have just one type of venom. Some snakes may actually have different combinations of these venoms.
And so the neurotoxic venom,
This is more like your coral snakes. Neurotoxic means it attacks the nervous system. So the symptoms that we're looking for that would indicate a nervous system toxin is they have droopy eyelids. Both eyelids will be droopy. They'll have weakness in their arms and legs, and it kind of starts close, the upper arms, descending down into the hands.
and they also will be short of breath.
And they may also be confused. That constellation of symptoms highly suggests to me that this person was bit by a neurotoxin. I'm thinking coral snake here, okay?
Now,
Our pit vipers
are highly associated with these 2 types of toxins.
the hemotoxic and the cytotoxic.
Hemotoxic means it attacks the blood.
Heme is blood.
So the first one is
What Dr. Gross was talking about, the coagulopathy. These are problems with clotting. The person can't clot their blood. So an example of that might be, if it's very severe, you'll actually see bleeding from their gums, bleeding from their nose, or if at the site of the bite, it's still oozing blood. That all suggests that the venom is attacking the person's ability to form clots. They're now at risk of bleeding.
So obviously if you see systemic bleeding,
That's where you see bleeding from the gums, bleeding from the nose, oozing, that type of thing. And then of course the local bleeding from the bite site. That's concerning. Now the cytotoxic means that the toxin is attacking the cells. It's attacking the tissue itself, okay? It's basically, think of it like acid that's actually burning the tissue. And
so this is where the
person gets the severe pain. That's where that severe pain comes from. This causes direct tissue destruction. So these are things I'm looking for: the swelling, the bruising, that type of thing. And then the progressive edema, that just means the swelling, okay? So that gives you some sense of kind of what the toxins do for the symptoms you're looking for that say that this person has poison, okay? They've been poisoned. Now, one of the things that you can do is take a marker and mark the bite. If you can see where the person was bit, put a circle around it. Let make it easy for me to find those bite marks, because it might be harder to find by the time I see the patient. The other thing is drawing a line to indicate the swelling, the degree of swelling. Now, it's very helpful for us to show that progression of swelling. So if you're the first person to see this person, and their hand is really already swollen, they get bit in the finger, and they're swollen up to the hand, put a marker line right across the edge of that swelling. Because by the time they get to me, I'm going to see that line, and I'm going to see that the swelling is up to here. Now I know that poison is progressing, okay? And I'm gonna draw another line and I'm gonna put a time on it. That's how I'm gonna tell whether or not the anti-venom I'm using is working and how well it's working. Do I need to continue to dose it, okay? Because it's when I start to see that that swelling is receding, now I can start backing off on the treatment, okay? So that is very helpful to us. As we mentioned, there's two symptoms that you can really mark. One is the swelling and the other is the pain. So that person might have been bit in the finger and they might have swelling up to the wrist, but they might tell you that they have pain up to the elbow. So you can mark both. Draw a solid line for the swelling and a dashed line for the pain and put a time on it. That tells me a lot of information. And I'm going to continue that as I manage the patient over the next few hours that they're in my emergency department. Does that make sense? So our initial management, this is the slide that's most relevant to all of you. So first thing you want to know is how sick is this person? Did they get bit but they look okay? Or did they get bit and you're seeing a lot of symptoms? Swelling of the face, bleeding, oozing from the bite mark. You know, they're confused. Those are all very worrisome symptoms. So the first thing you want to do is of course make sure that the person is away from the snake and you're away from the snake. Make sure it's safe. Try to do your best to calm the patient. Remember, they're probably going to be freaking out a little bit. The faster that heart's beating, the more circulation, the faster that blood is circulating that poison. So do your best to try to just calm the patient. Remove any jewelry or restrictive clothing. If I get bit on this hand, it doesn't matter where I get bit on this hand. The ring's coming off, the watch is coming off, the bracelet's coming off. You know, if I have long sleeves and a kind of a tight-fitting shirt, that shirt's coming off or it's getting cut. You know, anything that might be restrictive for that entire extremity, remove it. You want to remove it sooner than later. Mark the wound. Take that marker just like we just talked about. Now, when we talk about immobilizing the extremity, this is most relevant for the arm, and it's just a loose bandage just like that. And you want to keep it kind of at neutral position about heart level, okay? If it's hanging low, that can worsen the swelling. If it's up high, you're going to get that venom spreading more throughout the body. If you just put them in a loose bandage, a triangle bandage is what we call it, and just keep it right at heart level, it's going to keep it fairly neutral. That's a good position for them to be transported in. And then, of course, you're calling 911. You're getting the paramedics on scene because they can transport that patient. Most of the time, they can transport that patient faster than you can. But that depends on where you are, okay? If you're way out in the middle of nowhere and you know it's going to take the EMS, you got to call them first. They're going to take them 20 minutes to get to you. Then maybe you are the best, and your truck's sitting right there, maybe you are the best option to try to transport that patient. But we'll talk about that in the next slide. But remember that that venom can work very quickly. You need to be prepared that person, you could be halfway to the hospital and their mouth starts to swell. That's a very dangerous situation. That's why, generally speaking, you're safest to call the paramedics because they can manage any complications while the person is being transported. And you can't predict when that might be. During transport, you're focusing on pain control and of course, any basic wound first aid. And of course, getting those at least two large bore IVs and getting started on IV fluids.
Is that going to be bolus? And is it LR or NS or just NS?
So we'll talk about that on the next slide. LR or NS doesn't make a difference, whichever you have. And how much you're giving and how quickly really depends on what their blood pressure's doing. Okay? If that blood pressure is getting soft, you're going to bolus. If they've got a good blood pressure, you can just do a maintenance rate, and it's there if you need to bolus it. Yes?
If they get bit on the foot and they're being transported, I mean, what's the best position for the leg? If
So,
you're sitting there, your foot's down, or
yep, again, you're trying to keep it pretty even with the heart. So if they're on a stretcher, that's about where it needs to be. Yeah. Any other questions? Good questions.
So
Now let's talk about the sick patient, okay? And this is going to be information that's especially relevant to our EMS, but it's good for you guys to know as well, so you have some sense of what to expect. So this is a person who is unstable. This is a bad envenomation, and they're sick. So what you're looking for is signs of shock, okay? Shock, basically think of it as low blood pressure.
you're shocked with signs of angioedema, that's swelling of the face.
The tongue, the lips, the face in general, have them open their mouth, make sure there's no swelling in the back of the throat.
Any degree of confusion.
Altered mental status can look like a lot of things. The person might be confused, they might be very sleepy. You have to keep kind of poking them to get them to wake up and talk to you.
But any kind of altered mental status.
They might even be agitated and just not coherent, not really, you can't get them to focus or talk to you.
All of that's altered mental status. Any signs of
Persistent bleeding. A small little puncture mark really shouldn't bleed very much. If it's still persistently oozing, that's concerning.
and of course, any vomiting or diarrhea.
Any vomiting or diarrhea is a very bad sign.
Your first concern, of course, is always airway management.
And that's any degree of swelling in the face means you're worried about that airway. You have my permission to intubate that patient. Even if they're talking to you, if they have swelling in the mouth or lips, I'm not going to fault you for bringing them in with an airway.
Same thing if they get a bite above the shoulders.
Again, even if they no swelling, they're talking to you fine, they look great, bite above the shoulders, I'm not going to blame you for intubating that patient. Okay? The reason is because that they can lose that airway very quickly. And you don't want to be trying to get an airway once that swelling has already started. And so that's something for you as the public to also be aware of, is that if you have a family member who gets bit and the paramedics show up and they got bit right on the shoulder and the person looks fine, but the paramedics are like, nope, we're gonna give them medication to put them to sleep and put a tube down their throat, they're doing the right thing, okay? Even though it might look like it's unnecessary or overly aggressive, it's not. They could be saving that person's life. So the next thing you're worried about is circulation.
This is where you want those
Vitals, you want to make sure that their blood pressure isn't too low. You want to make sure that the heart rate isn't too fast. You want to make sure that, and this is something that anyone can do when you check how well are they blood circulating? Squeeze their finger. Squeeze it underneath their fingernail. Everyone's fingernails are pink underneath, all right? If you squeeze that and it takes more than 2 to 3 seconds to turn pink again, their blood pressure's low. And you don't need any special tools to do that. It's one of the first things I do if I have a sick patient, I walk up to the emergency department, I squeeze their finger. It kind of gives me a quick sense of how much do I need to be worried about this person. And anybody can do that. If you see any degree in circulation, any compromise in circulation, you're utilizing, and this is for EMS, you're utilizing your anaphylaxis protocols. Okay? That's epi. Epi. IM. Okay? And you get it, of course, that's where you're doing your bolus of fluids.
Now, a lot of what this is talking about is a condition called sun collapse syndrome.
Okay? Basically, think of this as it's like a severe allergic reaction to the bite. It's not technically an allergic reaction, but medically speaking, it resembles it. That's why you're using your anaphylaxis protocols for EMS.
And this can happen,
You'll notice the time frame, the first 5 to 30 minutes. Now, is this person usually in the hospital by then? Are they maybe still sitting there waiting for the ambulance to get there? Are they probably in the back of your ambulance on the way to the hospital? Definitely out here.
so this can happen before they get to the hospital.
This is why we're getting those IVs started. This is why we're watching that airway very closely so that we know how aggressive we need to be and how quickly.
What this looks like is
Essentially what I just described. Their blood pressure gets low, their heart gets fast, and they start to get confused. Those are all major red flags. The pre-hospital management is your anaphylaxis protocols, epinephrine and IV fluids. Now, these patients might need multiple doses of epinephrine. If you're having to give 2 doses of the intramuscular epi, then you probably need to be thinking about switching to a transfusion, okay? And then of course, rapid transport. These people need antivenom and they need it fast. Any questions? Clear as mud? So, here's some resources, okay? The Wilderness Medicine Society publishes practice guidelines. They're very helpful. They're very approachable. Anyone can read them. You know, you don't need to have a 10-year medical degree to read this. It's meant for the general public, okay? And it's good information. This one gets a little bit more technical, but the Joint Trauma System recently published just last year, Global Snake Envenomation Management. This is a great resource, and then there's also an app. So this is put out by the company that manufactures CrowFab. I've played with the app a little bit. I think Dr. Gross has played with it a little bit. I think it's pretty helpful. And certainly you guys get a lot of snake bites around here. This is something certainly for our EMS personnel. This may be helpful for you. What I would recommend that if you do download it, make sure you play around with it a little bit, familiarize yourself with it, because you want to know how to use it before you need it, okay? You don't want to be like, oh my God, my kid got bit by a snake and oh yeah, I downloaded this app 6 months ago, let me see what to do. So just be familiar with it, and then you can decide if you think it's going to be helpful to you or not. But I think it's a pretty good resource to be familiar with. Any questions? No? That's all I've got. What's that? It's free. It's a free app. I believe it's a free app.
It's in the App Store?
Mm-hmm. Yeah.
Did you have anything you wanted to add?
Yeah.
Before everybody decides to leave or anything like that, for the people that, just hit the button. It's a little purple with a like a satellite, but once you hit it, it gives you the coordinates of where you're at right away. So I mean, if you're out in the field, you get bit or anything like that, and you need a helicopter out there, you can get over there to your location. Normally, that's what they're asking. They're asking for coordinates. And you hit that, and it's going to give you the coordinates of where you're at direct. So once you give that to wherever you need to talk to, usually the fire chief, EMS, or the sheriff's department, they can send that information to the pilot, and that pilot will go directly to those coordinates. It's a free app. If you want to get it, you can get it. It's called My GPS. It's a little purple app with a satellite. It works wonders. I work for the King Ranch, it's King Ranch Security, and I've used it many times. So it's just a helpful tool for y'all to have, especially the people that are out in the field all the time. I mean, like I said, it's helped me out many times.
It's a great resource. Also, you don't even have to get out and you don't know where to use it. Let's say something gets bit, you're in a trench and putting yourself in the hospital. You're halfway to the hospital when they start to get sick. And you're somewhere on the side of the road. That's where that app can also be helpful. You don't need to be out in the middle of the woods, out in the middle of the bush to use that. If you're on the middle of the side of the road, it's going to be hard to be able to find you. But if you call 911 and you give them exact coordinates, they're going to get there quickly.
I know it sounds complicated, but actually in West Texas we use that a lot. We would clear
great source, like I said, I've used it many times to get with the border patrol, get with the sheriff's department, even locating, anybody that's out in the field or anything. I've used it many times, so to me, it's a wonderful tool.
Not only snake bites, but you have accidents that occur out there. You're in a four-wheeler and I kid you not, I've had several amputated legs from four-wheeler accidents in the middle of big ranches. And that helicopter, you need them out there quickly, and this is a great way. And they'll come out and they'll assess to see if there's a landing area. They'll find it, they'll hover, and if there's EMS there or if DPS or sheriff's office is out there, they'll clear a landing zone for them and get you out of there quickly. I think it's a great service. It's one of those things that we need to utilize, especially when we're sick. It actually it helps save the life or a limb.
And like I said, it's a free app.
Just remember also, Halo Fight, anybody can call Halo Fight, which is the closest one here. I know the Valley just, you guys are always looking out for your city, but anybody can call them and say, go